Hi, I'm Dr. Chip Riggins. I'm the Regional Medical Director for the Office of Public Health within the Louisiana Department of Health. My headquarters are here in Thibodaux. I cover the 7-parish area, which includes the river parishes of St. John, St. James, St. Charles, and Assumption, also Lafourche and Terrebonne, and St. Mary Parish to our west. I have the pleasure of talking with you today about COVID-19, the pandemic and its effect on our bayou parishes. And I appreciate you tuning in, and I appreciate everybody's support and patience during what's been a very trying time for our community. I'm a preventive medicine and public health physician. I specialize in the health of populations, which is driven by epidemiology, data, and statistics. And as you're hearing from career public health docs like Dr. Fauci these days, we're very focused on this pandemic and its response, and on a very steep learning curve. So it seems like the science is growing daily, and as that happens, our recommendations and the advice that you get in the public is changing very rapidly. So I'm going to try to give you a snapshot of where we are today, with the caveat that by tomorrow it's bound to change and it'll be different, but updated and based on our new knowledge and better understanding of this novel or new virus. So in today's talk, I'm going to go over and frame the issue as best I can by talking about some of the COVID-19 facts that we have, some of our data, including local data as best as we can visualize it now, our local prevention and testing opportunities, as well as the broad disease control measures that I'm sure you're all very intimately familiar with now. I'll talk about some of the challenges that you may not be aware of, and then we'll talk a little bit about the future and what recovery opportunities await us going forward. And then with the time remaining, I'll try to take your questions and answers. So what is a novel coronavirus, or what is a novel virus, period? One of the things that really catches the attention of a public health doc is that term novel. Novel sounds like it sounds innocuous. It sounds like, well, this is a very unique or singular virus. It's just, but to an epidemiologist, novel raises the hair on our backs, because novel means that our population has never seen this virus, and within our population, essentially, no one has immunity to it. So we'll talk about what that looks like, but the key word there is novel. It is brand new, and no one has immunity to this. So that's why it's become a pandemic, because globally, this is a new virus, and no one in any country had seen this virus or has any immunity to it. The actual name is SARS-CoV-2, but because SARS happened a few years back, and because of the potential for confusion, this virus and the disease that it causes is being referred to as COVID-19, and that's the year that this virus first emerged. So that's the term that I'll try to use today, is COVID-19, when I'm referring to this virus and the disease that it causes. It's spread by respiratory or droplet spread. I'm sure you've heard about that plenty of time, and that explains why we began with the cover your cough, the wash your hands, the clean the surfaces, and the wear your mask, and then we moved on to the social distancing and the ideas of isolation of sick individuals and quarantine or isolation of their contacts. Quarantine refers to people who are not symptomatic, and isolation to folks who do have symptoms of disease. Because this virus is novel, there really are no available treatments for it, that means that we have to provide what we call supportive therapy, and that includes support for a person's breathing and for their lung function. That's why you hear so much about ventilators. That's a form of supportive therapy. The recovery appears to be long, and a lot of folks have complications or complicated courses that they'll be recovering from for a long time. Folks are very interested in the idea that they may have antibodies, or that there may be evidence that they've had this infection already. And I think I could speak for all of us that we can't wait to have widespread availability of antibody studies. Unfortunately, those are at least a month or two out. But once we have it, we will have a better picture of this first wave, or tsunami, if you will, and how many of us were in fact infected during this first wave. We do know that 25 to, in some studies, 50% of individuals may not have symptoms at all, may not recognize that they've been ill, and will still have developed antibodies to this virus. So it's a very sneaky virus in that way, and very challenging to control because of that fact. Everyone's interested in the vaccines. I saw an interesting satirical article the other day about the vaccine that's currently in phase 1 trials, and they were very optimistic and said this virus should be available for anti-vaxxers to refuse as early as next year. So hopefully folks will accept this virus, especially folks that are at high risk, and we'll talk a little bit about what high risk looks like for this virus, and who really needs to be protected and concerned. Many of our efforts are those selfless or unselfish efforts to protect those at highest risk, to prevent preventable morbidity and mortality from this disease. There have been huge personal and social impacts, and I don't think I need to emphasize the economic burden that these measures have taken on our society, but I'll talk about some of the costs that we might have incurred had we not done them. So this is some of our current data on this slide. This is current as of yesterday, and by parish in our 7-parish region. So I'll just highlight Lafourche, where we are today at Nicholls State University. To date, we've had 13 deaths in Lafourche Parish, probably more. This data tends to lag, and deaths that occur outside the parish may also take a while to show up in our data. We also have 486 laboratory confirmed positive cases. We all know that there have probably been many, many more than that because of the limitation of laboratory testing. Those are only the folks that have been able to find and access laboratory testing during the time that they were ill. So that 486 in Lafourche Parish is likely to be much, much larger. We'll only know once we have the antibody testing, and we can do that on a widespread basis. As of yesterday, we have begun to see some decrease in the total number of cases per day and new hospitalizations per day. That's a very, very good sign, but not a sign that we need to relax our control measures. Our deaths remain elevated, much in disproportion to the number of cases, which is concerning. And it's taking about 11 days for folks who don't recover from this infection. It's taking about 11 days from the onset of symptoms until they succumb to this disease. The next phase that we're looking at, probably mid-May to late May, will be moving from this social mitigation, this social distancing phase, and broad stay-at-home orders. We'll be moving into a new phase that we'll be referring to more as a suppression phase, which is to suppress the rate of infection and keep it at the lowest possible level for our community. During suppression, we're going to go back to our more typical disease control measures, which includes rapid reporting by labs and physicians who diagnose new cases of the disease, prompt contact tracing, which is what we do in public health, which is we contact new cases of disease and we talk about their histories and we acquire their lists of household contacts, work contacts, school contacts, anyone that may be at risk in the window of potential infectiveness gets contacted by us, and we go over that very deliberately. In the early phases of COVID-19, contact investigation just wasn't possible. We didn't have prompt notification. It was taking days or weeks in some cases to get the lab confirmation back. So by the time we were trying to do contact tracing with cases, they had essentially recovered from their disease in most cases, and they had exposed others in ways that we couldn't go back and prevent. So hopefully, as we move into this new phase, we'll go back to what we're comfortable with in public health and as a community, which is only isolating those who are sick and only quarantining those who have already been in close contact with them. So that's going to take the whole community. It takes a lot of candor, and it takes us trying to prevent any stigma or reluctance that folks might have about sharing their contacts and where they have been, so that we can notify those folks anonymously, of course, but to let them know that they need to be alert for symptoms and that they should stay home until the incubation period has passed for them too. We know that with COVID-19 that you can communicate the disease, you can pass the disease on to others, both because many people don't have any symptoms whatsoever, but also because you may be infectious for 2 to 3 days before you ever exhibit symptoms. So very challenging in that regards. Our contact tracing will go back several days in the same way, asking about where you've been, who might have been in contact with you, and especially looking for high-risk settings such as nursing homes or other congregate settings where large groups of at-risk people may be in need of notification and protective measures. This is a popular infographic. People often ask about cleaning surfaces, and Jared was very courteous and cleaned the surfaces down for me before I arrived this afternoon. But you see here that the importance of cleaning surfaces on a regular basis, because just the droplets from my voice as I'm talking here may be falling onto these surfaces, and you can see how long the virus could perhaps stay here. Anyone else using this computer would need to be aware that this surface may contain the virus. If they touch this computer and then obviously touch their face, their nose, their eyes, as we frequently do, they can easily become infected with COVID-19, having never seen me or been here with me during this time. The CDC guidance is driving the national stay-at-home guidelines. It's also informing our Louisiana stay-at-home orders that Governor Edwards has issued. We continue to teach and educate. No one is too young to begin to live these principles of covering their cough and sneeze, of washing their hands frequently and disinfecting surfaces, as well as distancing ourselves from others. And one way that we can distance ourselves when we can't physically separate is the use of a mask. And that's one of the newer recommendations that has changed, is that when we can't, when we're going to be out in the community and we can't guarantee at least a 6-foot distance between us and others, that it's really a sign of respect, and that we wear a mask while we're outside, not to protect ourselves, but but protect other community members who may encounter us during a time when, without knowing it, we might be infectious. And as I said, that's very possible. We included some of the support lines because we know it's very difficult to stay at home for prolonged periods, especially if you're high risk, if you live alone or you don't have family close. The Louisiana Behavioral Support Line from South Central Human Services District is here. They're able to do counseling and support by phone. I hope folks that are experiencing stress or emotional issues related to this will reach out to them and avail yourselves of the counseling and the support services that we have. That's very, very important, and we know that this has been very, very stressful for many people. The Louisiana Questions and Assistance Hotline is available through 211. They can help you in many different ways, not the least of which is finding out where you might be able to get tested or with any other questions about resources in the community. The next slide is one that is fairly new. This is one that I'm sure students and others would like to become institutionalized, and this is a sign your own return to work certificate. This is a form that's been requested by folks that have had illness or were in quarantine and now believe that they do meet the criteria, which is right here on the form. One of the most frequent questions that I get is, when can I go back to work? And the CDC right now says that if you've been afebrile for at least 3 days without taking fever reducers, and it's been at least 7 days since your symptoms began, and your symptoms, such as call for shortness of breath, are gone or are greatly reduced, then it's safe for you to go back. This slide talks about when you do go back, some of the things that you should do, and of course wearing a face mask just out of respect, again, because we can't be sure we really can't be sure, even with testing, that it's not possible for someone who's recovered to still be spreading virus. So wearing a face mask for the 14 days that follow an episode of COVID is absolutely appropriate. Many places are now taking temperatures at least once a shift at work, sometimes more than once, looking for temperature, which can be one of the early signs of COVID-19. Avoid using other employees' desks or tools as much as possible, and respecting their space, especially if you're not wearing a mask, but and rearranging your desks and workspaces to promote as much physical distance as possible and the least amount of sharing of air. Other guidelines may be set by your employer depending on the nature of your work. Sharing headsets or other objects like masks or reusable masks that you use on or near your face is not recommended. And congregating, even in other places like the break room or the restroom, or any other place where it may be crowded, is really to be avoided. So I know #flatten the curve. Everyone's been hearing about this. I chose a little different version of the slide to share with you today. It's a little bit of a historical lesson. This slide looks a little bit different than the ones that you see that show the flattening of the curve, but it's an actual epidemiologic, an epi-curve of the 1918 flu and the experience that 2 different communities had, one of which implemented early on in the course, that was the St. Louis community, and one that continued to have parades and other events farther into the epidemic. And you see what happened in those 2 communities. If you wait too long, you see this huge spike. That huge spike, while the number of cases may be very much the same as in the other community, that huge spike is very, very disruptive. It's very potentially disruptive to our healthcare community. It may be disruptive to have so many cases in a very short, in this case, really less than 2 month or month and a half period of time, puts other services at risk. It puts nursing homes at risk. It puts food services or food outlets at risk, or drugstores or other essential services that we need to remain open when we have this many cases and this many sick people in the population at one time. We really put our whole community in danger, not just our healthcare workers, but the whole community. So you may want to read about the experience. There's many good depictions that you won't have any difficulty finding about what happens when you don't flatten the curve in a pandemic, or when a new or novel virus is sweeping the globe. But this is a very dramatic example of what can happen and why we're trying to prevent it. In our region, I really can't emphasize enough that I believe that our local healthcare could be overwhelmed. We're encouraged by the flattening of the curve that we're experiencing right now, but we're concerned because our region has been identified as one that's extremely vulnerable to being overwhelmed in our healthcare system. Our healthcare system at best can surge up to about 20%. That is, it can stop doing elective procedures or other things in order to create capacity, and they have done that. But we're a suburban region, and we're very dependent on the urban areas to our north that provide additional beds for our population. And if those communities become overwhelmed themselves and we can't refer patients out of our region and out of our facilities, our regional hospitals could very easily become overwhelmed, and that would impact all of us who need to access those services and those healthcare for other things, not even related to COVID, but strokes or heart attacks or trauma, needs to be able to access our facilities. We cannot overwhelm them with COVID-19 cases. This slide we look at on a daily basis on our healthcare system calls, and I thought I'd ask our viewers today to guess which line on this graph of available beds represents our region. I know it's too small to read, so you can't cheat. But you guessed it. The bottom line is our Region 3 parishes. We're far below any other region in the state with less than 400 beds available in our region. That just shows why we're so dependent on the New Orleans and the Baton Rouge area for bed capacity, and why our efforts to stay at home and flatten the curve for our hospitals is so important in Region 3. If you have symptoms, testing, thankfully, is becoming more and more available. Right now, we have 3 large access points in our region. We have in the river parishes, at Hahnville High School, at the Walmart in St. John Parish in Laplace, and in St. James at the elementary school. In St. James Parish, we also have drive-through testing available right now. That's testing capability that was once in New Orleans that has moved to our region to help us get caught up with the need for testing. But you can call 211 and find out where testing is available near you, or you can visit our Facebook page, and we'll share that again with you today. The tests that are available right now are still the viral testing, which requires a nasal swab. Everyone is very interested in when the blood test or other more accurate tests are going to be available. We are expanding our capacity in this region this week, to do more rapid tests more locally without having to ship it off or to rely on outside labs. So we're glad that our rapid testing capabilities are improving. That's not going to be a panacea, unfortunately, until we have rapid testing of antibodies and can really test the whole population and have enough capacity to test asymptomatic persons as well. We're still going to not have a good feel for how many cases we have in our region. It'll still be the tip of the iceberg, unfortunately, for some time. But I want to encourage folks, if they do have symptoms, if they have fever, to contact their physician. It's best to call ahead, but with a physician's order or with symptoms, you can present at one of these testing sites. The turnaround time currently is about 2 days, in some cases a little bit longer. But now the labs are catching up and you can get your results in a couple of days. I would implore everyone that avails themselves of testing to be willing to self-isolate until you know your test results. We hear story after story of folks who availed themselves of testing and returned to work or returned to business as usual, only to find out that they've been there during a period when their test comes back that they were in fact positive. So please isolate if you get tested. I encourage you to get tested. And I encourage you to notify your close contacts, especially high-risk household or work contacts. Let them know so that they can quarantine or also stay at home during the period when they might develop symptoms of COVID. It seems to take an average of about 4 to 5 days. That's just the average time that it takes from exposure to symptoms. But the range may be up to 11 or 12 days, and that's why quarantine is for a 2-week period. One of the challenges that we're hearing about more and more is that there are significant disparities in who is getting COVID-19 and who is dying from COVID-19. This doesn't surprise us in public health. Every year we look at maps like the one you see here of the state of Louisiana, and we see the disparities in health by parish, and where people are already affected by many of the underlying conditions, the chronic diseases, the diseases like hypertension and cardiovascular disease, diabetes and chronic kidney disease, obesity, asthma, and other pulmonary diseases. So these are more prevalent in those areas, but they're very prevalent in Louisiana overall compared to many states, as you know. So the determinants of health that run deep in our state are at work here, and really none of us were surprised to see this. Currently, deaths among COVID-19 cases, about 59% of them are in the African American community, and there's another 9% or so that the race is unknown, so that may actually be higher. And that's given that only 32% of blacks make up 32% of our overall population. So very disproportionately affected by COVID-19, and I think that's something that we're going to have to grapple with as a state and look for ways that we can address those disparities, both in the underlying conditions, but also in the social conditions that lead to higher rates of disease in our community. Every disaster becomes an exercise in allocating scarce resources, and this one has been no different. As you know, the availability of test kits has been very limited. A lot of frustration around being able to get tested, and we completely understand that. It's been very unfortunate that this virus was both novel, so there was no pre-existing test for it, and it was difficult technically in some ways. Also because of the way that this virus is transmitted so easily and so broadly, we needed to develop not small amounts of very accurate testing, but we needed to develop testing on a very large scale very quickly, and that is scientifically very challenging. So test kits continue to be allocated. We're continuing to try to grow that, but it's still not available to everyone. And I think the important thing to remember now is that this is a national and to some extent a global problem with this pandemic. This is not an isolated local problem that folks don't. In fact, in Louisiana, we have tested a higher number per capita. More of our residents have been tested than in any other state. So while it has seemed very frustrating and very difficult, it's actually been a little bit better in Louisiana than across the country. Personal protective equipment, it just seems like we can't have enough. And personal protective equipment is something that we owe our healthcare providers. They go to work every day and put themselves in harm's way. We have to take care of our healthcare workers and our first responders who really have to respond to situations in our community. We have that same social contract with them. So PPE is in very short supply, and we continue to try to manage that. We have an allocation working group in this region that looks at all the needs and all the competing interests for PPE, from essential government services and utilities and services that need to continue to nursing homes and healthcare facilities. We look at that on a regular basis and try to manage our scarce resources as best we can. Rooms, beds, ICU rooms, and isolation rooms have all been in short supply, and we continue to see a shortage of skilled nursing beds. If you need a nursing home bed right now, it's very, very difficult to get a nursing home to accept someone that needs skilled nursing and has needs beyond what can be done at home. So we're continuing to look at those scarce resources and to manage that as well. Staffing is in short supply. I'm very concerned about our nursing home staff who really are heroes in their own right and are currently the front line of the battle with COVID right now is in our nursing homes. And I just want to reach out to them and thank them for continuing to go to work every day and to take care of our most fragile folks in our population. So thank you for what you do. Thank you to all of our healthcare first responders for continuing to respond, especially in this region. I think that's the spirit of the Bayou region. Contact tracing, we didn't have enough staff to do that. We're trying to build some surge capacity. We'll try not to ration it, but I think the thing with contact tracing is that in the next phase, it's going to be very important that we get very quick, accurate assessments of the contacts involved and exposed around new cases. And that's where we'll need the cooperation of each one of you and of the public to make sure that we identify those who may have been exposed to them, and we do those notifications and quarantine them appropriately. And by doing that, we can release our stay-at-home order. Currently, we're quarantining everyone, and not only quarantining everyone, but a lot of our parishes have added curfews to that. So you're not even allowed to drive around on your own after certain hours. So between the curfews and the stay-at-home order, it is a big imposition, and it's difficult on us socially. And in order to get out from under that, we're going to need to do a much better job of contact tracing. Folks are going to have to be honest and forthright, and we'll have to put more people into quarantine at the time that they're exposed, rather than keeping the whole population in quarantine. Crisis standards of care exist, and in our case, in our region, we're using an allocation work group, and it's broad. It includes representatives from different areas, from different disciplines or sectors, and from all of our parishes. So we're trying to look at it very equitably, do the best we can with managing scarce resources, and also looking at the impact of grief and stress on our first responders, because they are seeing more death and more disease and experiencing a lot of toxic stress right now. So we have to take care of them as well. One of the challenges with a novel virus is that, as I said at the beginning of this video, that the guidance and the resources are constantly being updated and changed. So one of the ways that you can keep track of that and make sure that you're always accessing the most recent version of these documents and resources is to use our dashboard, our public health portal, which is at LDH or Louisiana.gov/coronavirus. Go there, and the little box in the center there that says guidance and resources, that will automatically link you to the most current versions of CDC guidance. And CDC has been wonderful to create guidance for nursing homes and correctional facilities and workplaces and the faith community, healthcare providers of all sorts. You'll find information there for you if you're sick or if you have questions, even for the general public, for folks with children and what children, how to deal with children during coronavirus pandemic. You'll find a lot of resources there. So please check out the dashboard and use the guidance and resources link to the most current resources. As we start to think about recovery, and we're a little reluctant to think too far ahead, but we can't help but be optimistic and look at what will the future hold, and how will we take the lessons learned and the insight gained from this pandemic to make our communities more resilient, to make our communities healthier and in a better place. To make us more resilient is to make our economy stronger. And a lot of folks have made that connection and are working together on collective action plans and health improvement plans for our community. We have to approach it as individuals. We're going to have to get better at talking with each other in the community. We have regional stewardship efforts to look at evidence-based programs and policies that we can adapt that fit our culture here in the region. And our state has a state health assessment, state health improvement plan that will be rolling out in early 2021, hopefully about the same time as the vaccine. So nationally, it's time to think about Healthy People 2030. That's a decade-long goal for our nation that we look at every decade, and those goals are coming out in 2020. And so we'll be thinking about Healthy People 2030 as a nation. And there's been nothing like COVID-19 to remind us that we're a global community. This pandemic has affected us internationally and shown how closely we are, how interdependent we are with our sister countries. No matter how rich or poor those countries are, our health is linked to their health. And I think there's going to be some really important and vital discussions that we have about our global community and what we can do together to prepare and to prevent pandemics like this. Some of the things that I'm thinking about in the way of approaches, whether it's at the individual or community or state level, resilience and being trauma-informed. Look it up. Trauma-informed. The schools and education system has been trauma-informed for some time. The healthcare system likes to believe that it's also that trauma-informed healthcare is the nature. But I think these disparities are really raising up what what does trauma do and how early does it start in our population? I talked about collective impact. That's what groups do. Task forces, we have many work groups and task forces that are already focused on the health of our communities and improving health outcomes. Stewardship is really that leadership. It's really that commitment to collective action and to having those discussions and those dialogues that show that we're willing to deal with difficult issues, not ignore them, but to do ethical, moral, and compassionate consideration of how we can make our communities better. Here in the Bayou region, we have our SHA Ship. We're going to be starting that. We've been delayed by a couple of months. We were right at the initial assessment phase, but we'll be rejoining that as soon as we can, focused on equity, resilience, and really a strong basis of knowing our communities, knowing our culture, and knowing what the opportunities are for us locally. One of the keys to building trust in communities for collective action is to dialogue. It's to communicate. It's to listen and to understand problems from many different perspectives. And dialogue and deliberation, we have groups that have been trained now to facilitate that, and I'm really looking forward to more dialogue and deliberation after COVID-19 relaxes our control measures. Evidence-informed solutions are always wise. Those of you that are familiar with continuous quality improvement know that these difficult problems require that type of iterative approach that never ends, that shows our commitment to change, to evaluate, to monitor, and to then reconsider if what we're doing is working, and to work smart in that way. So all of this is part of our website that you see, which is the CAN, the Collective Action Network, and our Facebook page. And with that, I'm going to open it up to a few questions. Some were submitted in advance, and I wish each of you a rapid return to what is normal for you. Let's see. One of these is, where is Region 3 on the curve, and has the region peaked? Well, that's a good question, I'm afraid to say. I think for this wave, I think it's safe to say that we have definitely slowed and flattened the curve in our communities. As I said, our death rate still hasn't really shown signs of abating, so that's concerning, but our number of hospitalizations is not as great as our number of discharges across Region 3, which is a good sign. It means our hospitals are having better and better days. The folks that are still in the hospital continue to die. Unfortunately, I think yesterday or the day before was our state's worst day for the total number of deaths. So the number of new cases hopefully is slowing. The deaths continue to worry us, and I think it's likely that we have flattened the curve. It's not likely that enough of us are immune to the virus or have had the virus at this point that it could not come back, reemerge, and pose a problem again. So we'll have no way of knowing that for some time. Any ways to identify people who might be asymptomatic? No, unfortunately. I'm aware of a nursing home in Arkansas recently that was tested. They tested the entire nursing home, and what they found was that the symptomatic employees and the symptomatic residents, in fact, had about a 70% positivity rate on the test. That's about as good as our test is. It detects about 70% of known cases of COVID-19 because it's just not a perfect test. what surprised them was that there was an additional 10 nursing home residents who had no symptoms whatsoever who also tested positive for the virus. They had the virus in their nose and throat. They had not had a fever. They had no symptoms whatsoever. They looked very closely for any possible sign. They lowered the threshold for what they called a temperature, and they looked for conjunctivitis or pink eye or red eyes. They looked for everything possible, and they could not detect any other signs or symptoms. So unfortunately, the answer to that is no. There's no good way. There are just going to be folks who have no symptoms whatsoever, but who are capable of transmitting the virus. And that's why this new recommendation that the CDC has had is so important about if you have to be out and about, it really is a thoughtful thing. It's a considerate thing to wear a mask, because you cannot know, even if you yourself might have the virus at any point in time. What can we do beyond social distancing to decrease the number of cases? Well, as an epidemiologist, I already mentioned one, which is, cooperate with your health department, talk to your doctor, get tested, and then be candid when we contact you for your contact investigation. Tell us where you've been, tell us who we can notify, isolate yourself and don't be out and about, and quarantine your close household contacts. Ask them to stay home. Rely on your support systems, whether it's your church, your family, your neighbors. Help each other out so that if you're in isolation or quarantine in the future, you should not be out for any reason. We're going to ask that folks don't do their grocery shopping, don't go to the drugstore or any other, quote, essential services that they rely on others if they are in isolation or quarantine. That's what we can really do, and that's what we're going to have to go back to. That's what we do with diseases on a normal basis, and I think that's going to be key to getting our economy and our society back open again. Let's see. Can people avoid contracting the virus more than once? Well, this would be a very unusual virus if it doesn't leave you with some amount of immunity. Most infections leave you with at least short-term immunity from getting the virus again. What we've learned about coronavirus is that folks can relapse, and folks who've been in the hospital have gone home seemingly on the mend, only to relapse and develop symptoms and to begin worsening again. So a relapse is not the same as this question is asking about getting the virus or being reinfected with the virus. Only time will tell if this is a long-term immunity. Either way, if it's short-term immunity or if it's very little immunity, the vaccine hopefully will take the place of that, and hopefully the vaccine will provide any additional immunity that we need to keep these outbreaks from occurring due to this virus. How long should people stay quarantined if they have the virus? Well, I'm going to change the question just slightly. If you have the virus or you're sick, you should stay isolated for at least 7 days from the onset of your symptoms. And that presumes that you've been afebrile for at least 3 days without having to take a fever reducer like Tylenol, and that your symptoms have abated or your symptoms have resolved. If your symptoms have resolved, it's been 7 days since you first got sick, and you've been without a fever for 3 days, then you can come out of isolation. Again, look back at my slide about wearing a mask and being very cautious about cleaning surfaces that you may touch, because you could still be infectious. But we believe that you can return to life as usual. If you're healthy, but you've been exposed to someone with COVID-19, then you're in quarantine. You should be quarantining yourself. And unfortunately, you may have to stay in quarantine for up to 2 weeks. If you don't develop symptoms within 2 weeks, then your quarantine period can be considered over. Um, you dodged it this time, but 2 weeks of quarantine, if you remain well, is really a necessary period to make sure that you get beyond the longest incubation periods that we see with this virus. Do you think the U.S. would possibly use a similar app like China has for people to move about as a way of loosening stay-at-home orders? Well, I'm actually not too familiar with the app. I know that they are using apps that are cell phone based, not apps, but data from our cell phone use to see phones and how close they are in proximity to each other as an indicator of how well we're social distancing. There have been some privacy concerns in our country about using that data just of our cell phone in proximity to each other. So I don't know how accepted an app would be. In terms of big data, there's some other websites you might be interested in. There's one that's called Health Weather Map, which is actually also data that's being gathered from electronic thermometers. And this map shows how many people with fever exist in our communities and whether trends are changing in the rate and the number of people with febrile illness from thermometer data nationally. So check that one out. Health Weather Map, I think, is the name of it by Kinsa. So there's a lot of interesting use of data, and all of them are potentially helpful during our stay at home or in the future as we return to isolation and quarantine of cases and their contacts. But for the time being, we've got to stay at home. We've got to continue these efforts. We've got to continue to flatten the curve until we're clearly past this tsunami of cases that our country has experienced. Jared, were there any other questions?
We do have a couple of submitted questions on the chat feature. Dr. Alex Arsenault asks, our community just celebrated Easter. While many respected the stay-at-home order, there were groups that congregated to celebrate with family, etc. Do you believe we will see an uptick in cases?
Well, I know that's true, and I know the governor even remarked, because he was looking at some of the data for the long Easter weekend and saying he was also afraid that we had loosened our social distancing and not really respected the stay-at-home order over the long weekend. If we do, it won't take long to see the results. We'll see an uptick in cases probably in an average of 4 to 5 days, but as long as 12 days after the weekend, we'll see an uptick in possible cases. I hope we don't see that, but it's certainly possible. Hopefully those folks that did congregate were using the other measures. They were covering their coughs or wearing masks. They were maintaining physical separation. Even if they were together, they were trying to maintain their 6 feet of distance. So I know just because they had congregate settings or groups less than 10, hopefully that they may be there may be hopefully the possibility that did not result in an inordinate number of new cases, but we won't have to wait long to see.
Lisa Hidalgo asks, is it possible to have is it possible to have symptoms that include coughing and chills but no fever?
Fever is a very common symptom of COVID-19. However, just because you don't have a fever or it's a very low-grade fever, a cough, and especially cough with shortness of breath, may be indicative of COVID-19. Sneezing is not common with COVID, and I know a lot of folks have cough with sneezing and other symptoms this time of year because of their allergies, and it's spring, and So there's a lot of that out there. So sneezing, not so much. If sneezing is present, I think you can be a little more assured that it's unlikely to be COVID. But a cough, especially a cough with fever, and if that becomes accompanied with shortness of breath, that is likely indicative of a possible COVID infection.
Bethany Lejean asks, how is the Center for Community Preparedness coordinating with local OEPs to help parishes to be prepared?
Well, that's a great question. The Center for Community Preparedness, or BCP, in the Louisiana Department of Health and the Office of Public Health, we operate the EOC for public health and medical for the state, and then in each region is connected to the Bureau of Community Preparedness, or BCP. We host currently 3 times a week. We have a morning report or a morning ESFA meeting with all of our stakeholders, including the parishes and the OEPs, and it includes all of the public health and medical operations, from hospitals to outpatient, federally qualified health centers, behavioral and mental health, home health and hospice, long-term care facilities, EMS, and of course nursing homes. They're all on the call. And we do a roll call with them, and we do a check-in with them to see what their needs are. We discuss interdependent problems, like between our ERs and nursing homes, or hospice and nursing homes, or home health. We talk about those issues, those needs, and so it's being coordinated. That's on behalf of BCP, and using the staff that the CDC grant funds are at the core of that capability and that activity. But our parishes have been great. Many of our elected officials have joined those calls over the last month or a month and a half to stay abreast of what's going on in our public health and medical community. So I think we have great communication in this region and really good processes. It's just a very difficult situation. So thank you for that question, though. Well, look us up on Facebook, Public Health Can, and I appreciate your time today.